bariatric surgery, metabolic surgery patients are complicated. They have usually comorbidities or other conditions, and that requires input from other specialists. Nutrition, which is dietary or ingestion of fluids or supplements, is critical. And I have been so honored to have Sherese partner with me and Ijewere since it started all these years back. So I'm going to let her introduce herself.
My name is Sherese Ijewere. I am a clinical nutrition consultant, a gut health practitioner, and a lifestyle medicine practitioner. So I've been working with Dr. Okaro for the last 15 years. So I would say that the dietary aspect has changed tremendously. We're now seeing a lot of processed foods, a lot of restaurants. People are working, so they don't have a lot of time, so a lot of quick cooking going on. So what we're seeing is rice. Maybe people will eat rice 2-3 times a day. They may decide to eat rice every day. We're seeing a lot of bread eating. Just a lot of processed food. So even lunches for children and adults, it's quick things: noodles, snacks, spaghetti, biscuits, crackers, small chops as well.
And then the drinkables.
The drinks, yes.
Yeah, the fizzies.
Yes, the fizzy drinks. Mm-hmm.
The carton drinks, the juices that have all sorts of things. Obesity is global. The problem's global. I think that, as we said earlier, the one that is really shocking is childhood obesity. You know, and that I think is a kind of a insight to the problems coming, not to talk of diabetes and hypertension. So unfortunately, yes, it's a massive problem.
Big epidemic that we're facing.
So the patients interface with us through various platforms, mostly I think word of mouth, but of course we have Instagram coming up and other social medias. So we start by seeing them, having the conversation, really getting to understand the patient in terms of their starting weight and as a consequence their body mass index, any associated conditions like hypertension or diabetes or sleep apnea and so on. Of course, any prior surgeries become relevant. Mm-hmm. The big one is what they want, expectation, I think, in terms of weight for the target, but also treatment options that they are willing or not willing to have, because they can create restrictions just in conversation. And then of course we get to know if they have any allergies and so on. So that's the journey. That journey, which is the initial meeting's purpose, is to define the size of the problem, the risk stratification of the patient, but also the management plan. And part of that is getting to an idea of their diet. And of course, Sherese, I think maybe you can tell us a little bit about, because that's really key at that beginning, to know maybe their palate, the bad habits.
So I think also with our consultation, we get to the psychology of the patient, checking out their attitude, their willingness to change, whether they're optimistic or pessimistic, and then also their behavior, what the action is after that. So diving into their nutrition, their diet, what are the foods that they're drawn to, what are the foods that they're addicted to, and having conversations around that before they're then approved for surgery.
Now it is important that we talk about this diet addiction conversation, I think, because really what we want, and we find that we get better, I think, rapport and better, deeper conversations with patients, those that are not in denial, because we have a lot of delusional patients who don't have connection between what they do and eat and their weight, and we need to break that. That is very important in the mind, so that we can clearly take or create responsibility or ownership as we can and intervene. That's important, right?
Very, very. I think one of the things we emphasize with our patients as well is that this is a tool. So with the tool comes change, and that's change on the lifestyle of the patient.
That is central. we think, which is why a consultation can take from 20 minutes sometimes to 45 minutes. And of course, the other bit that is absolutely important is the support system around the patient. It's very important that patients have carers or loved ones that support them. You know, I think that's really important, because these are, you know, kind of tough journeys. So we established that, and I think at the end of a meeting we would know, well, we'll have a feeling for whether the patient is going to be able to at least go along with this journey, which I think Sherese will come to in a minute when it comes to the pre-op diet and the restrictions that are there pre and post surgery, mostly for safety, and that's why they have to have that ownership, I think, for safety.
Yes. So the preparation is from the time they decide that yes, this is what they want to do. I am quite strict with our patients because it's safety. It's all about safety, good outcomes. So we give them the informational booklet, and then I go through step by step with the patient what they need to purchase as far as protein. It's a high protein diet, lots of vegetables on this diet, and then of course lots of water as well. And in addition, the lifestyle change of let's get you moving, let's walk. So we give them a target. So they have targets to meet. They will take a picture of the target daily, and the pre-op diet is about 14 days. So keeping in touch with them every couple of days, and they're excited. And they're excited for this new challenge, and them just following through tells us that they are ready for the change.
Yeah, I think that's very important. I think it's, you know, we like to remind patients it's a two-way relationship. We have responsibilities, but they also have responsibilities to us in terms of compliance, I think, for safety. So the gastro system is adjusted with surgery, whether it's a sleeve or the bypass. And unfortunately, we've been able to, I think, show that if you have a smaller stomach or you have a bypassed duodenum, the absorption of certain compounds, micronutrients, is disrupted. Things like iron, I think, is a classic one, vitamin B, I think 12, for example, and some other compounds. So we give them, or we suggest, and well, we mandate them actually to have supplements, because unfortunately the body, you know, if left without them, would probably be deficient over time, which can cause other issues, anemia, immunity issues, of course, hair, and so on. So the supplementation, I think, is very, very, very vital, I think, and it's kind of gold standard, I think, in terms of patient care.
And it's not general supplements. General supplements are for the general population. So it's bariatric supplements, which means that these are chelated for absorption. Yeah,
that's very, very vital. You can't just go and buy a whole bunch of different things in a chemist. You really need to use the bariatric ones. Yes, thank you. That's very important.
Well, I will say that because we educate them quite well and we follow up, the follow-up is quite tight, maybe they will want to fast forward on the program. So for about 4 to 6 weeks or so, we have them on liquids. It's staged liquids. For 2 weeks, it's liquids with the consistency of water, and then it's advanced to purees, and then advanced to soft foods, and then regular foods. So maybe they feel that with reading on Google or listening to their friends that yes, they want to advance themselves. And sometimes if they advance themselves, they get into a little trouble, and that's when I'll get a phone call. Oh no, I took this, I'm feeling like a heaviness on my chest, what do I do? And my response at times would be, okay, let's walk around, let's do some deep breathing, let's get you back to balance. And then they overcome that, and then they're like, I will not do that again. I will make sure I listen.
If you've listened to our conversation, I suspect you'll get a sense that, you know, our objective is not just, you know, doing an operation, which is easy in terms of getting it technically done. No, Sherese as the anchor to the service, and obviously the creative piece in terms of how we approach the care is really around holistic care, and it's absolutely critical. Over the last 15 years, I have learned so much and imbibed the concept of holistic, integrated medicine and wellness. And that's really moved the practice over the years. Obviously, thanks to Sherese and her background, I think, because it is a mind, body, soul, spirit arrangement, and I think that's something that we think benefits our patients, right?
Absolutely.
And Sherese, I'm sure, will probably touch on a little bit about that. The other thing I have to say, which I think again you may get a little sense of, is that because of Sherese's and her team, which is the nutritional team, Sherese is here, but she's got a lot of people that work behind for her to support her. They literally give a 24/7 service, which is amazing in a lot of ways. It's just amazing. That, I think, is unusual, and we recognize her for that.
Thank you, Doctor.
So I don't know whether you want to just talk about this holistic, because I know you guys have a very deep understanding of it.
So I think this is really icing on the cake that we give this much support to our bariatric patients. We're listening to what's said, what's not said. We are also observing a lot. So their sleep pattern, how they're feeling throughout the day. We even have them with a journal. So they write down, their emotions, because there is that mind-body connection. Your mind is saying one thing, the body is saying another thing. At times you have where the clients feel like, well, I did this procedure and I'm happy, but I'm seeing all my people eat, so they're trying to battle with certain things. So because we are both trained in psychology and just listening to the back end of the patient, we're able to resolve a lot of issues.
Yeah. And this is really different to what you would possibly get even in Europe and where we practice, because they're all time-slotted appointments. I know we offer a lot more, I think, to patients, partly because I think of course you help to really integrate that in or bake it into our service, but also we like to take our time. We don't like to rush.
We're not rushing.
We're not rushing. We're never rushing. We want to take our time, because I think we want to be able to, at least in the very initial phase of pioneering and bedding down this service in the region, to make sure that we have the best possible results for the safety of our patients, right?
Yes.
And weight loss ultimately.
Yes.
For them.
And great results means more referrals. Of course, even looking into the holistic aspect. So something as simple as just getting sunshine. People are indoors all the time, and that sunshine is also helping with the repairing, the recovery. Even walking outside barefooted, something called grounding. Yes, just connecting with Mother Nature really helps the recovery of the patient. So we go into those tidbits of the holistic care.
And I think we benefit from it ourselves.
Yes,
right?
absolutely. We're practicing what we preach.
And I think that makes a difference. So thank you.